At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Is Sugar Still Public Enemy #1 on Wednesday, May 21st at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on WMAL 105.9. Glad that you're with me. We got another program on sugar and your heart. And I want you to understand that, you're going to play Russian roulette if that sugar habit gets way too high. And that's going to be the topic as part of the topic of our slide in on the 21st, coming up in about a week and a half. And we'd like to join a bunch of you to come in, and we're going to talk about what happens when that sugar level gets too high, the effect it has on your heart. But we're going to talk about diabetes. We're going to talk about inflammatory pain. We're going to talk about dementia. We're going to talk about a lot of different things. And it's going to be Dr. Scott Lamp and I co-teaching. And all of you who have met Dr. Lamp before know that he's amazing. He's brilliant. He's one of the guys that, has more knowledge going around in his head. Sometimes it gets confusing. I tease him all the time. But he's truly one of the people that I have tremendous amount of respect for. So join us on the 21st. All you have to do is call 703-698-7117. That's 703-698-7117. And tell them that you'd like to attend. And all we ask you to do is that if something comes up, you can't make it, just give us a call and say, hey, I'm sorry that I'm not going to be there, so we can open up, the platform for other people. The other way that you can do it, go to drtomroselle.com and register there. Or the best way is rosellecare.com, ROSELLECARE.com. And you can register right there. You'll see the site. You go right down, click it, register, you're good. We'll remind you, and we won't bug you, but we'll remind you. We'll tell you what's going on. So let's talk about your heart on sugar. So excessive sugar intake is linked to increased risk of heart disease, and it does it through a lot of different mechanisms. What mechanisms are we talking about, you might say? Well, blood pressure. Yep, your sugar intake can increase your blood pressure significantly. It can do it through creating diabetes. Yep, diabetic patterns will cause you increased risk of cardiovascular disease. And by the way, problems with your brain leading to strokes and so forth. So there's ways of getting this down. We're going to talk about that a little bit today. But you have to understand that this whole thing has to do with raising inflammatory reactions throughout the body. So let's dig into it a little bit. And, is sugar always bad for you? It depends on how much you're eating. But as we're talking about your heart doesn't need sugar. It needs other things. And we're talking about things that convert into sugar. But, when you think about those of you who like to have those sodas on a day-to-day basis, did you realize that there's somewhere in the neighborhood between 8 to 12 teaspoons of sugar per soda? You heard me. That's not an exaggeration. That's right on the mark. And when that's true, and that sugar will, remember we talked about how if you heat it, it becomes, basically something that sticks heavily, turns brown, and it locks into, your arterial base and things of that nature. Well, I don't know about you, but that scares the hell out of me. And so it's just enough to make me not want to go there. But sugar and diabetes and heart disease, they're kind of all linked together. If you did your homework and you really start looking at this stuff, you're going to say, wow, what's What am I going to do about all this? So sugar affects your heart in a lot of different ways. And most of it comes down to the ugly, sticky kind of cholesterol. Cholesterol by itself is not a big deal. Matter of fact, if you look at the research and you look at cholesterol as a package, it only really contributes to about 0.5% of all cardiovascular problems. But you say, my doctor said cholesterol is a problem. Yep, and they drop it down way too much. It's the bad guys that are the problem. And that's not just talking about your LDLs, which everybody says that's the bad guys, but it's the subfractions of the LDLs. And what does that stand for? That stands for low density lipotropic factors. But you have low density lipotrophic factors, big A, low density lipotrophic factors, small a, low density lipotrophic factors, big B. And you have to know the differences. And we're going to talk about that, by the way, on the 21st. We're going to tell you what happens. And we're going to tell you about the pain that comes about because of your ignoring these things, and pain that you don't know where it's coming from. And now you're on drugs that cause other problems. And wouldn't you like to get off of it? Well, we're going to show you that there's a possibility that you have a path to getting your life back when you join us on the 21st. So please do that. Join us. Don't ignore your health because, I hope that you're going to be around for a long time. I want to be around for a long time. We're going to, share what I do. We're going to share what should be done. And we're going to make sure that you have the tools in front of you. You know what the worst thing is? This is the worst thing. If you know what to do and if you don't, that there's an outcome that's deadly. That's the worst thing. So I'm going to put you in that hot spot on the 21st. I'm going to tell you what could be done. I'm going to show you how to get out of the crazy. I'm going to show you how to get rid of the pain. I'm going to show you how to get your life back. And when you have all that information in front of you and you know that it's possible to reverse virtually anything that takes place in the body and you don't do it, then it's on you, right? So when we're looking at the different pieces of the puzzle, we can go in, we can look at that cholesterol thing, but you know what it leads back to? It leads back to the conversion of sugars into these fats, not anything else. It's not about eating cholesterol or not eating cholesterol types of foods. It has a lot more to do with what we're talking about. So we're going to talk about LDLCs and we're going to talk about LDL, A's and B's and so forth. And we're going to tell you what happens, but we're going to tell you what to do about it because you can get yourself out of this quagmire. You can reverse it. You can make a difference. But how about the pain that just kind of sits there? You don't know where the hell it's coming from. That pain is the prodromal to something that can be much more serious. And sometimes it's just a joint pain someplace, and that joint can be breaking down. We have to make sure that we understand it. Remember, we talked about AGEs. Those are those things that when sugar gets heated, it gets to plaque. That's your AGEs. We're going to talk about, altered substances and how they affect the heart. We're going to talk about mitochondrial dysfunction. We're going to talk about myocardial cell death. There's lots of things you need to know about. And if you ignore them, it's really on you. 1 20-ounce bottle of soda, contains about 65 grams of sugar, or the equivalent of about 16 sugar packs, right? 16, you open them up to a minute. 1 20-ounce bottle of soda. How many of you do a couple of those a day? And you think that there's not an issue? Think about how it's affecting your brain. You can thank your brain, for that kind of that 3 p.m. afternoon chocolate craving. That's because the sugar stimulates something called dopamine. Dopamine's your feel-good chemical that pushes you to do all kinds of stuff. It gives you that positive feedback. The heart, it turns out that diet that's too high in sugar is very bad for the heart. And it's proven time after time. I go to Cleveland Clinic doctor's heart site. Because why? Because they have all the data. Or, you can go to PubMed and they've got some good information. But too much sugar in the bloodstream increases your insulin levels. It increases your risk of heart disease gradually over a period of time. It's going to get you It's not a matter of if, it's a matter of when. So how do we turn that fire off? How do we look at the liver and its relationship to the heart? If you listen to the program, you've heard me say that when the liver is not functioning, it can shut the heart down. If your liver is being overburdened with sugars or things that convert into sugar, like what? Like alcohol, then you can have a problem with the heart, because the liver in energetic medicine feeds, supports the heart. So if it overwhelms it, you got a problem. Remember, we talked about joint pain, right? All of a sudden, you got all this pain in your joints, you got degeneration taking place. Joints are affected by sugar. Why? Because it leads to inflammatory reaction, which can worsen something that's already irritated, something that's already damaged. If the muscles aren't working the way it's supposed to, ultimately doing what? It turns into arthritis. So those of you who have arthritis and have a sweet tooth, guess what's going to happen? You are in big, big trouble. So the heart is one of the bellwethers of and the recipient, if you will, of a diet that is too heavily burdened in sugar. So you sit there and say, okay, I'm listening to all this, but I don't know if I can do it. I don't know if I can get rid of the sugar. I don't know if I can change my lifestyle. I don't know if I can, do little things like go for a walk and cut back on what I'm supposed to be doing. And well, we're going to show you how to do that. And I want you to join me on the 21st at 6 p.m. at the Roselle Center for Healing in Fairfax. I want to make sure that you have the tools to save your life, basically, to turn things around. Sugar is basically a revolver that you're playing Russian roulette with. Pretty soon, you spin that chamber often enough, it's going to come up. And if you're lucky, it'll take you out. But what happens if you're not lucky? What happens if you just end up paralyzed, or you end up not being able to articulate, if you end up not being able to function, or your memory's not there? Because it's something that could have been avoided, something that you can turn around. But when you figure that you have 1 20-ounce bottle of soda contains 65 grams of sugar, which is way in excess of what it should be to begin with. What if that heart attack that's just sitting there brewing, waiting for it to happen, gets you? The hidden sugar in your body, or that comes in your body from your dietary patterns, right? It can obviously cause all kinds of silly things, and I don't mean silly, in the normal sense, but how about, the decay of your teeth and your gums? That's from sugar, my friends. How about your skin? What does my skin have to do with it? Well, all those dark spots, that aging and so forth, that has to do with your inability to break it down. The rosacea, the acne, and so forth. That's sugar. I tell kids when they come in too, they start out that age. And as we get older, you see all these plaquing areas on our body. It has to do with the alcohol that we consume, which converts into what? Sugar. But it's also a bellwether that if it's happening there, it's happening inside. It's affecting your heart. That sugar acceleration and aging exacerbates the heart. Makes a huge, huge difference. Liver is the processor. It gets rid of all the junk. It converts the surplus sugar that you're getting into fat. That's what the fatty liver disease a lot of people get. Yeah, it has to do with what you're putting in your mouth. But remember, I just said that liver affects the heart. Yep, it sure does. So overloading the liver with sugar is similar to just drinking way too much. The effect is the same. People, well, I don't drink. Oh, what's your sweet tooth like? That's the same process. Sugar converts into alcohol, and it'll affect every system. So we have to understand that we are the culprit. We're the initiator. Because why? Because we don't want to eat. I had a patient the other day, and I talked to him. He's actually a United States Marine, and young guy, about 25 years old. And I asked him what he eats. He was referred in by his wife, and he started telling me that, he doesn't, he really doesn't eat a lot of food. He drinks energy drinks, and he drinks candy bars, and he grabs sodas, And then maybe, at nighttime, he'll have a hamburger or he'll have a mac and cheese or something. Do you know what's going to happen to this young man? This young man is shortening his lifespan, minimally going to cause all kinds of irreversible degenerative conditions that are going to take place. I asked him about heart pain, and he already told me that he's starting to feel some fibrillation in his heart. If that's the case, if that's really happening, this boy's not going to be around for a long time. How many of you do the same thing? How many of you catch as catch can? How many of you grab a soda in the afternoon and a candy bar? How many of you, get something that's sweet? You want not just on occasion, just on a special occasion. Everybody can do that. That's all right. But we've become couch potatoes. We don't move. We don't do. And this guy, U.S. Marine, what does he do? He's on a keyboard all the time. So he's not getting a whole lot of activity on top of that. He's not even burning it off anymore. Look, you have an option. You have the ability to take control of your life. And I'm going to show you how to do that on the 21st. Dr. Scott Lamp and I are going to go back and forth, and we can get very playful with this, but I'm going to demonstrate it to you. I'm going to show it to you. Do you realize that there's a muscle that's related to every organ system in your body, including the heart? And it's behind your shoulder. It's underneath your shoulder blade. It's called the subscapular muscle, subscapularis. And a lot of you who have shoulder pain are getting warning signs because that muscle's not working the way it's supposed to, so the shoulder mechanism isn't working, so you got pain. But it's directly related to your heart. Now you got to fix that because it's going to cause all kinds of other problems. It's going to cause degenerative disease in the joint space of the shoulder. It's not supporting the neck and shoulder mechanism, so now you're going to have problems there. And it all started with ignoring the fact that you're feeding all kinds of junk that your heart can't handle. And now that organ muscle platform is being affected. So if that's the case, do you want it just to creep up and, grab you? Or do you want to do something about it? Do you want to learn how to, I got to stop this nonsense? Well, the Roselle Center for Healing in Fairfax has a tremendous integrative staff. Got some brilliant people. I'm humbled because I get to work with them, from the nutrition department to the applied kinesiological chiropractic department to the acupuncture department. And they work as a team. So they start picking things apart and they give optimization. The most successful patient is the one that decides to be proactive and take control of their own life. They say, okay, enough is enough. I'm not doing this anymore. I'm tired of feeling like garbage. I want to feel better. I want to have energy. I want circulation back. I want to be able to walk up a set of stairs and not feel like I'm totally exhausted and broken down. Wouldn't that be an amazing gift that you could give to yourself? Well, there's ways of doing that. And I want to share that with you on the 21st. Please join us. Register today. As soon as the program's over, you can do it right now when you're sitting there if you're on your cell phone. Just go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com, and register. Make it a promise to yourself that enough's enough. Many of you came off New Year's and made all these crazy, commitments to do X, Y, and Z, and you dropped them out because you really walked through it properly. You're still hurting. You're still on all the narcotics. You're still on all the drugs, and one perpetuates the symptoms of the other. Wouldn't it be great if you can reverse this craziness? We're going to show you how. How about little things like, how do you balance your diet out? How do you slowly begin exchange? I'm not telling you got to give everything up forever. I'm saying that if you don't do something now, you may not be here next week, next month, next year. And yeah, life isn't promised to anybody, but wouldn't you like to increase the odds on your side for the time that we all have on the planet? I don't know about you, but I keep trying to get better. My granddaughter the other day said, Grandpa, are you going to be around when, and she said, when I'm married and I have kids? I said, baby, I'm going to be around when your kids have kids. And she looked at me, she says, how's that possible? Because she's quick with the math, she's, clicking it together. I said, look, I'm doing everything that I can to make sure that there's longevity because I got too much to do. And I want to do it with a clear head. I want to do it with a body that works. I want to do it with, the ability to make my own decisions, not have somebody else make decisions for me. I have a dear friend that we just received information on. This guy was one of an amazing contributor to this country. And he was a guy that was very formidable in all kinds of logistical plays that, I really can't get into. But all of a sudden, he starts breaking down. And it's something that could have been avoided over a period of time. And you don't want to get to that place where your mind's not working like it used to work. You don't want to get to that place where you can't have the energy just to even go for a walk. You don't want to get to the place where, you're just hanging out, waiting for everything to end. This program on the 21st is going to give you tools. It's going to give you capacity and understanding that is probably going to be second to none that you can get anyplace else. Why? Because we'll never lie to you. Why? Because we're going to give you the ability to shift things. Why? Because we're going to encourage you to change something and make a difference. The 21st, coming up very quickly, week from this coming Wednesday evening at the Roselle Center for Healing in Fairfax, 6 p.m. Join us. We're going to start, on time as best we possibly can, and we're going to respect your time, but we're going to walk away with ideas and tools and ability to change the effect that it's having not only in your heart, but on other areas of your body as well. The pain, that swollen knee, what's that got to do with anything? Well, we know that in acupuncture, there's several points around the knee that has to do with liver function and gallbladder function. So if you're shoving all kinds of stuff in there, you're going to get inflammatory reactions. We've already told you repetitively that when that big toe flares up in a gouty type of condition, that's liver function. Now, why would it be on your big toe? Again, because the energy point for the liver starts on the big toe. So in Asian medicine, they call it energy stagnation. Things aren't moving the way they're supposed to. So if I can show you how to fix that, are you willing to take the information and move forward with it? If I told you that it's reversible, would you say, I don't believe you, or would you be willing to try it, particularly if it's not going to have an impact, on your lifestyle and things that you do? If I told you that you can reclaim your life, would you do what is necessary to take the chance to get something back that you may have lost a long time ago? Get rid of the pain. Do something different. I never tell a patient they've got to go on a diet to lose weight, right? Because think about the word diet, the first three letters, and that's how everybody looks at it. They're taking their lifestyle away from them, right? But how about a diet that's going to give you your life back? That you're going to focus on what you should be doing, not what you need to stay away from. You're giving yourself better options. You're giving yourself things that you can do that will dramatically, exponentially increase your lifestyle to a point where you're actually enjoying it again instead of dropping it down. I don't know about you, but, I'm in that later part of time where people start leaving. I don't intend to join them, not for a long time. Yeah, we're all going to leave at some point, but I want to do it my way. I want to make sure that I have a choice in the matter. So we're going to do that on the 21st. We're going to give you the tools. I'm going to tell you what I do. Those of you who've been around me know that, I had a little bit of a struggle for a few years, but I turned that around 100%. I want to show you what's possible and how you can turn it around 100% as well. We're coming up to that place in the program where I'm going to tell you, make sure you join me on Ageless Health live stream right now following the program. Go to drtomroselle.com, drtomroselle.com. Click the button, join me. We'll continue this conversation. We're going to talk more about your heart, and we're going to talk about the information's out there. Thanks for listening in today. We're going to the live stream now. Remember, I'm here every Sunday, same old time, one reason only. I love you all. You deserve the information.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend is Sugar Still Public Enemy #1 on Wednesday, May 21st at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.